So moved.
This is Mary.
Do we have a second?
Second.
Thank you, Mary. All those in favor of approving the meeting, say aye.
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 All those
Aye.
opposed? Wonderful, the minutes are approved. Now, we did not have the meeting in April. I don't know if we have to do anything about that, Beth, or not.
Not that I'm aware of. I think we're okay.
Okay, wonderful. If, I'll turn it over to you.
Sure.
If you could go down the agenda of what we have to do, if there's
Sure.
any, I don't know if there's any action items that we have to approve this meeting?
There is not.
Okay, wonderful. That'll speed things up and make it a little more simple.
Yes. I can run down the list of the agenda, if that would be helpful.
Great,
Okay, so
wonderful.
the first two things I'm actually going to combine is the director's update and what we're doing around COVID-19. The next one is IPI production. That'll be Dan Clark. The next will be a budget update from Steve, and then we'll have public comments, open discussion, and then adjournment. So if you're ready for me,
Wonderful.
I can go ahead and do the update.
Go ahead.
Okay, so it's been a while since we've all been together. So I'm going to really combine, like I said, my director's update with the COVID-19. This this is going to be probably a rather lengthy update because I want to make sure that you're all aware in terms of what we're doing, what's going on in terms of COVID across IDOC. So as many of you know, for the last 2 months, we've been dealing and planning for COVID-19. It's been extraordinary in terms of the leadership we've seen across IDOC and the staff coming together to mitigate the spread of COVID-19. We've been planning for months. We've been working on policy, but we've been doing tabletop exercises. It's just been amazing to see the leadership and how well staff has responded to this. And I also, at this time, I'd like to thank that we have a central office, it's an incident command team here that we meet every single day. The wardens, the district directors, IPI has been instrumental in terms of providing personal protective equipment. It's just been a very great, excellent joint effort. So what I'm going to focus on just today for my update is in 4 areas, and that's going to be the current status of COVID-19 cases for both staff and individuals in the department, what we're doing, our practices and strategies to mitigate the impact and the spread of the virus, some of the strategies that we're using currently to reduce the prison population so we have more room to move people around when we have a spread. And then I'm going to let Dan do the production of PPEs. He has current numbers, so I don't want to steal his thunder on that one, so I'm going to pass that to him when that time comes. But basically what we're doing is on a daily basis, we're meeting with the wardens, the district directors, and incident command, talking about current cases, the health of staff, any type of issues that are happening. We're also providing guidance and strategy from public health and CDC. So we're constantly working with our docs who've done an excellent job in terms of giving us great guidance on how to handle some of these cases. We also stood up 2 phone lines, COVID-19 phone lines, one for staff and one for the public, because we know that there's a lot of questions around what we're doing, especially around visitation and people's loved ones that they're concerned about when we have cases in the prison. So we have 2 hotlines now that are functioning Monday through Friday. So as of today, in our prisons, we have 18 positive cases at IMCC of individuals that are incarcerated. We have 1, as of yesterday, at Clarinda Correctional Facility. We have 6 staff at IMCC that are COVID positive, and 1 at ICIW. We have tested 377 individuals that are incarcerated. We have 39 pending for individuals incarcerated and 29 staff pending at this point in time. So that's the update in terms of what our numbers look like. Also, I want to talk about some of our main responses that we have done in terms to mitigate the introduction of and the spread of COVID-19 in our facilities. So many of you know we canceled volunteer activities on March 9th until further notice. So we're trying to reduce the number of people coming into the prison. So we're trying to minimize that as much as possible unless they're essential. We canceled all visitation March 14th until further notice. And this includes sending all DOC work crews out into the businesses and into the community as well. To address the issue around visitation, because we know we want people to have contact with their loved ones and family members, we have gone to video visitation, which has been very successful. We've gotten a lot of positive feedback across all of our institutions. So we got some help from OCIO with some Chromebooks. Dan Clark was great in Cord in terms of, and Jason Holder in terms of their leadership to make this happen. We're giving out 4 free O-mails per week and 1 5-minute free phone call per week. So we're trying to encourage people to stay in contact with their loved ones. So those are some of the measures that we have taken so we can keep people connected, because we just don't know when we'll be opening up visitation, especially anytime soon. We're also screening employees and contractors when entering the facility for symptoms, and we're actually taking temperatures as well. We're screening every inmate that comes in through intake and placing them in quarantine for 14 days. And I'm going to talk about admissions here in a second. And we're asking all staff in our prisons to wear masks. And we're strongly encouraging incarcerated individuals to wear masks as well. But in the prisons where we have COVID, which is CCF and IMCC, the individuals incarcerated must wear masks now. It's mandatory and required. We also update our pandemic policy to be more in line with COVID-19. We've been doing video messages. The doctors, Dr. Greenfield and myself, have been doing video messages to individuals incarcerated, as well as weekly director updates, just to tell staff kind of what the state of the state, what's happening around COVID-19, thanking them for all their service and the work that they're doing. So we're doing video messages as well. The docs and the medical staff are consistently monitoring inmates for symptoms. We're doing random temperature checks at most of our institutions, and at IMCC I think they're doing them twice a day. We have staff that have been trained in infection control procedures on how to use the supply and use PPEs, the personal protective equipment. We are asking staff to stay home if they're sick. We're asking them a series of questions before they come to work, as well as taking their temperature to see if they could possibly be have COVID. So we're trying to keep that out of the prisons as much as we can. We have clean teams that have been developed to consistently disinfect high traffic areas as well. We basically reduced any type of transporting between prisons at this point in time. What we have done is I have reached out to the Sheriff's Association about a week and a half, 2 weeks ago, and asked to stop all admissions and revocations to our prisons. So that's another way we can kind of turn off the faucet in terms of exposure. So we are in week 2 of having no admissions for the most part. We extended that 1 more week until May 11th. So at this point in time, we're really not having any admissions unless it's like a critical situation or a situation where jail just needs to bring someone to us. So that has had really a significant impact in terms of being able to contain the spread, especially at IMCC. Also, we've been working with the Board of Parole too, as well, to get more people out of our prisons. As you know, we've been over capacity for some time now. And so we are at, today our prison count is 8,091, which is huge because March 1st, our population was 8,495. So we've reduced our population by 404. And this is the lowest we've been since June 30th, 2013. So this is the lowest our population has been. And again, for a lot of reasons, is we need to have room to quarantine people if we do have positive cases. So we've been working very diligently and collaboratively with the Board of Parole. Our staff here at Central Office has been working with the wardens, treatment directors, district directors. The board has been great. They've really ramped up their decisions. They're making a lot of decisions. They've been doing double boards. And so that's really starting to show in terms of the releases that are getting, number of releases of people leaving our prisons. So that's been a great partnership. We've been working with the district directors to, if people are violating the conditions of the supervision, to keep them in the community if they don't pose a public safety risk. So that's one of the things we've been working as well. Sally has done an excellent job working with the district directors in terms of trying to keep those individuals in the community if they're not posing a risk. Again, so it's been, this has kind of been our world the last 2 months. We continue again to get people out safely, responsibly, back into the community. I do want to share with you before I turn over for Dan, and he can give you his statistics in terms of what they've done for manufacturing PPE, is that how we fare against other states around us in terms of COVID-19 cases. So I just want to share with you a few states what it looks like for them. So Missouri has 30 positive COVID inmates. Wisconsin has 18. Ohio has 3,656. Indiana has 334. Kansas has 81. Minnesota has 79, and Illinois has 155. I think, in terms of how we're faring against other states, I think we're doing an excellent job in terms of our numbers and mitigating the spread. And that's attributed to our staff, our doctors, the leadership across the state in terms of doing the right things, following the guidance, be very strategic and thoughtful around the planning and implementation of our master action plan. So it's a huge kudos to our staff, the reason why we're in the position we are. With that said, I'm going to turn it over to Dan, and then we'll, so he can talk about PPEs, and we can open up for questions, if that makes sense.
Yeah, thank you. Wonderful presentation. Thank you so much.
Okay, thank you, Director. Hopefully everybody can hear me okay.
Yes.
Yes, Dan.
Yes.
Okay, so thanks for the opportunity to talk today to the board about production of personal protective equipment, both for the department and for the state. So in early March, the director asked me if we could get the resources of IPI to prepare both the Department of Corrections and the wider state for what we expected to be with the virus situation. And if you remember back, things have changed a lot, but even at the beginning of March, it wasn't clear exactly whether people should wear masks, what kind of masks. There were a lot of questions floating around. So we worked with the medical directors, Jerry Greenfield and Dr. Cook, with corrections operations, Bill Sperslagi, with our safety director, Samantha Tucker, and put together some plans for producing first masks. So a design was agreed upon for both staff and for all of our incarcerated men and women. And we made the determination early on as a department that we wanted to provide each person with 3 masks so they'd be able to wear a mask and then later change out or clean it out and maintain a supply of clean masks for themselves. So to date, we've been producing masks at 4 different locations and have produced more than 85,000 masks. So for all the incarcerated men and women, they have a minimum of 3. And we provided really just tens of thousands to the CBCs, county jails, DHS, and other facilities. So the mass production has gone very well. As you might know, we have textile production at both Fort Dodge and at Mitchellville. So I would say that was a relatively easy task for us, was to start producing the masks once we worked with the docs to decide on a design. The next product we went to, and I'm going to try to share my screen, show you a few pictures, was hand sanitizer. So hopefully everybody can see these pictures here. Oops. So hand sanitizer was a lot more complicated. That's a product that is FDA regulated, so we had to register as a drug production facility. So we're both registered drug production and alcohol user facility. So we had to register with both the FDA and the alcohol, tobacco, and firearms under their new name. But this was a product that was developed and is being produced at Mitchellville. So a director came in and she talked to the women there. We had a lot of great work by our staff and by our associates to, not wanting to behave here, sorry, to produce that. I seem to be hung up here. So I'm going to stop sharing and go back to it. Sorry about that. So as I mentioned, that was a more challenging exercise. We had to develop quality systems that were more advanced than we normally do as a FDA registered facility. And but I do believe that is one of the steps we've taken as a department to ensure the health and safety of both our staff and the people that we supervise. A number of states still do not allow that. So today we produced 24,000 gallons of hand sanitizer, and believe me, a gallon of hand sanitizer goes a long way. So that represents more than 46 million doses. And we're just wrapping up our production today. It'll be our last day of production. The private sector is starting to fill the pipeline. And so that's been really just a great thing. I'm very proud of the people there at Mitchellville that have made that happen. The third item that we started producing were patient gowns. So this is a product that we had started out producing 200 gowns a day at Fort Dodge. And the need for gowns for staff that are working with either incarcerated individuals or long-term care facilities, DHS facilities, the Iowa Veterans Home, and so on, are just asking for thousands. For example, the Vets Home, we've provided 4,000 gowns, and they've asked for another 3,000. So there's just huge quantities of this item being needed. And so the director asked us to increase the production from 200 to 1,000 a day. So that five-fold increase has been successfully accomplished by the men at Fort Dodge. So we have a great team of staff and associates up there. And in addition, they also have produced all the pre-cut components to sew a gown and provided 3,000 of those to the Fort Dodge community. So working with Iowa Central Community College, home sewers came by the college, picked up these pre-cut kits of components, brought them home, sewed them in their home, and brought them back. So when all's done, we'll wrap this up next week. An additional 3,000 gowns have been produced by members of the Fort Dodge community. And, pardon me, so I'm very proud of what the folks at Fort Dodge have accomplished. And now we have moved gown production, or expanded it, both to Anamosa and to Mitchellville as well. So then the fourth item was a face shield, like a welder's mask. And this is needed for healthcare providers or folks that are dealing with infected persons or suspected infected persons, or those that are accompanying incarcerated men and women to the hospitals, especially in Iowa City. So these are being produced at Anamosa. We produced more than 12,000 so far. And so that team in Anamosa really had to deal with a lot of adversity, because the supply of materials to make anything for this pandemic is a problem. No matter what you try to go out and buy right now, be it elastic or plastic or hand sanitizer or toilet paper, whatever it is, it's gone. I mean, the shelves are clear from every level of the supply chain. But they developed some alternative designs. They used different pieces of equipment and completely different parts of our Anamosa shop, and now are really doing a great job to protect men and women within the department, as well as other citizens in the state. So then on top of that, our normal products that, we produce disinfecting and sanitizing products, floor cleaners, spray bottles of disinfectants, products for kitchen and laundry, industrial kitchens and laundry, like our prisons. And those were immediately wiped out. I mean, we had people we had never heard of just call and say, whatever you got, I'll buy it all. And it was really a panic situation in early March. So the commercial team and our production folks in Anamosa were holding daily allocation meetings, parceling out, what we had. Was it going to go to the Vets Home, or is it going to go to community-based corrections or the Fort Dodge prison? So really, they worked hard to try to give everybody what they needed. in a oversold and just a panic situation. That has really calmed down to where they were meeting 2 times a week, and now it looks like once a week. And so we've been able to provide those products to schools and universities, prisons, and other DHS institutions. So, and, you know, just I can't tell you how proud we are of the folks that are in our program and the department, how well they've worked with the institutions and the safety director and safety officers. We have 4 plants, as I mentioned. I didn't mention Fort Madison. They're also producing masks. So we have 4 different locations producing PPE for both the State Emergency Operations Center, as well as the department. 3 of those plants are working 7 days a week, so we're really trying to go as fast as we can, you know, knowing that it's possible we'll have interruptions at our different institutions if and when the virus comes in. So I just want to really say that it's been I'll say, a silver lining to a very dark cloud for our state. Also, Cord, I think, is in the meeting today. Cord also produced some videos for users of the hand sanitizer. So especially to warn users to keep it away from children. One of the things the FDA was very worried about is that everybody has hand sanitizer everywhere now. It is a toxic product. And so they did see an increase in calls to poison centers across the nation. And so Cord did a great job to make sure users were aware of that, keep that in mind. You know, if you're in a daycare center, don't just leave that hand sanitizer just out anywhere. And then also he put up on our website a video for how to make a gown for all those community sewers and some documents to help people. So it has been, you know, a positive experience in that regard. Much of the production that didn't go to the department or other so-called Tier 1 facilities, and that would be the Veterans Home and the DHS facilities, has gone to the State Emergency Operations Center. They're operating in central Iowa, and that's the so-called National Guard. They then distribute the product out throughout the state to all the county emergency management organizations. So to date, all that product's being provided at no cost. So we're keeping track, and hopefully when the dust settles, you know, we'll be able to be reimbursed by FEMA. But really just the director asked, and the men and women in the IPI program just have charged ahead and worked really, really hard, and are very proud of their role and the ability to do something positive. And that's not just staff, but also incarcerated men and women. The director recorded a video for the men at Fort Dodge that worked Easter Sunday. They worked 12 hours on Easter Sunday, and she, as I mentioned, visited the production of hand sanitizer in Mitchellville. So they read about, you know, they see the same news that we do, but they also see the recognition for the positive things that they're doing to help the state and the department to wrestle with this virus. So that's all I had. I don't know if you want to if there are any questions, but I do appreciate the opportunity, and I'm thankful that, you know, IPI was able to come in and play a small part in helping the reaction of the department. Okay, and that's it for me. Thank you, Director.
Thank you, Dan. Really appreciate all the work that you're doing. When you hear the numbers, it's absolutely unbelievable what you've accomplished in your team the last couple months. So thank you for all that you've done in your leadership. So Rick, we can open up to questions. If that makes sense at this point.
This is Larry, Beth. Just a quick question. Do we know how the person at Clorinda came down with the illness? Did he come from the outside, like at Oakdale, or was this? Do we have any feel for that?
We're still looking. You're still looking into that. What I can tell you is that we haven't been doing transports, so we're guessing it's probably an asymptomatic staff member potentially that brought it in. So we're testing staff, again, screening staff. That's the best we know right now in terms of how that came in, because we're not doing admissions and we're not transporting unless it's an absolute it's necessary. So that's what we're guessing at this point in time, but we're still looking into contact tracing and all that stuff.
And do we know, do we have any data as far, maybe this is a question for Sally, maybe she's got, but do we know the numbers of people that are out there that are being handled by the districts as far as might have it, or staff and people that we supervise out there?
Go ahead, Sally.
Sorry, trying to unmute myself. Larry, to be honest, we quit tracking people that are on field supervision because there were so many of them. What we're seeing is the hot spots exactly where you would guess. A lot of our folks work at Tyson and the other places. So I couldn't give you an accurate number on those in the field. In the residential facilities, we've actually had two people recover. And if Joanne is on, I think she's got the exact numbers. But we had in Waterloo, Marshalltown, and we're monitoring for outbreaks at Fort Des Moines right now. So again, it's all those places where they work. They're essential workers.
Okay, thank you.
Are there any other questions?
Beth, this is Mark. Just a question regarding the video visits for families.
Mm-hmm.
Have we seen an increase in, obviously, I'm assuming the incarcerated individuals are taking advantage of this. Has it caused any staff issues in terms of additional staff needed? Because I'm assuming most visits, you know, on the weekends, I don't know what our percentage was, but I'm assuming most individuals are taking advantage of the video chat, or is that not a good statement?
No, I think in terms of staffing resources, I haven't heard any issue around that, getting people to the computers and desktops and things like that. What I have heard mostly is the positive stuff, because people that are getting to visit with people that are in another state that haven't seen their kid or their child for years are getting to see them face to face. So we've heard really, and Cord, you can chime in here, nothing but very positive things. At first, to get it going, liftoff was a little rough because people, on the other side, not the individuals incarcerated, but family members getting used to using the video type visitation type stuff was a little challenging at first, but we worked through those issues. But as far as I know, it's been very, very positive. I haven't heard anything about in terms of staffing issues around that. Cord, do you want to add anything?
So, yeah, just to add on there, we have implemented the video visits at every prison right now, and this is a very temporary solution because it's essentially built on the Google Hangouts platform, thanks to our friends at Google that have helped us set that up, and doesn't have all the security features or kind of, I think, the user-friendliness that you would need in a long-term prison video visitation solution, something we continue to work on and should have implemented at some point in the future. What's really happened is you've kind of traded off the duties of those officers that would work the visiting room. Now they're just working the video visitation system, and it functions a lot like a regular visit, only taking place over that Google Hangouts platform as opposed to, in person. So they're still monitoring, walking around the room, making sure nothing inappropriate is happening, things like that. And yeah, like the director said, the response from the incarcerated folks that have used it has been overwhelmingly positive.
We anticipate that going forward. I heard you mention something in the short term.
It's just to get us through the COVID-19 crisis and until we can get a more permanent solution put in place. Of course, we wouldn't want to rush into a contract with a vendor that we later regret. So it'll be something for the longer term that we'll continue to be working on.
Any other questions?
Anyone else?
Oh, go ahead.
I do have one more for Dan, and first off, I really appreciate what IPI is doing and the response that they've had, and I just think that's great, Dan. I appreciate that. You've mentioned that you're keeping track of the cost so far. Do you have a feel for what the number is right now, and is that causing a financial burden for you guys at this point in time?
To this moment, not yet, Larry. I forgot to mention the hand sanitizer program was put together in partnership with the Iowa Renewable Fuels Association. So the renewable fuels plants in the state and also in Nebraska actually donated all of the ethanol, glycerin, and then we got the water from Templeton Rye of all places. So, you know, we had, of course, staff and offender and distribution costs, but so far it hasn't been something that has caused us to a great deal of concern. But I think, like the department, all of us are a little worried about what the future is going to bring, you know, with state revenue being down so deep. But to this moment, Larry, no, it hasn't been an issue. Thank you. Director, you might just want to mention the 2 hotlines that the department set up.
Yes, I did. I did in my opening statements. Yep, for staff. Apparently you weren't paying
Sorry.
attention.
I guess I was.
You were
That
so
happens
busted.
with Zoom. Sorry.
Yeah, no, I appreciate that. I even thanked you too, I think. Jeez. So
Anyone else? You want to move to the next
yes,
phase?
that would be the budget update, Steve?
Sure. Can everybody hear me?
Yes.
Okay. Okay. So we'll do the budget update. I did send out some handouts, and we'll reference those. Those aren't necessarily the main topics of the conversation. You know, they kind of give you an idea of where we're at. For FY20, we are in pretty good shape still. We have had some additional costs, as you imagine, with the COVID-19 outbreak. Specifically, some areas that we've had additional costs or will be having additional costs is our county confinement. When we did cut those admissions off and left those folks in county jails, of course, they're going to want to bill for those services, and we have, at this point in time, allowed them to do that. The bad thing is that's in arrears, so we haven't necessarily seen the impact through the billing as of yet. We are looking into how many bad days that we've got at this point in time. But that's one of those areas that we will seek federal reimbursement for through the different federal programs, the CARES Act and such, to replace those expenses and hopefully fill that void. Another area that we've had increased expenses is our electronic monitoring. Similar type of reasoning. Those folks that are being left in CBC and not being rebooked to prison, and we're working with those folks. Sometimes we're putting on additional ability to track them through the global positioning GPS software and bracelets and such. So we have, at this point in time, we have worked with the vendor through the judicial district, and we have a tracking mechanism already on place for those folks that would meet those thresholds. Once again, so that we can submit that for federal reimbursement when the time comes. Other areas that we've also had increased expenses. Of course, we've had PPE expenses that we have purchased sometimes outside of IPI at our institutions and districts. Those should be fully reimbursable through the federal programs, whether it be FEMA or the CARES Act or other federal resources. Some technology increases that we've had to do because of our mobile workforce. Another area that we've had to add computers, we've had to boost lines, boost our VPN access. Those are other things that we're going to also submit through the CARES Act and other federal resources. Cleaning products, thermometers, those types of things that we've needed to continue to operate safely and make sure that our workforce and those coming into our facilities are safe. Those are, once again, additional costs that we've seen through the COVID. That once again will be put through those federal sources of revenue. Unfortunately, we haven't necessarily gotten we've gotten FEMA pretty much ready to go. That's kind of our last resort as far as seeking reimbursement, and the reason why that is it comes back at 75% of the cost, so we only get 75% of that value back. Some of the other sources that we're still waiting on application processes, such as the CARES Act and some burn JAG funding through the Coronavirus Relief Act. Those are being administered by state agencies, and the application process is not open. So we're still in that process of gathering the information, making sure we're keeping track as we go of all those expenses. So when the time comes and those things open up, we're ready to submit for reimbursement. Hopefully at that point in time, that makes us whole in those areas. So as far as the expenditure or the budget scope for FY20, for the institutions, once again, we're fairly reliant on appropriations. 99%, I believe, of our expenditures are funded through appropriations. At this point in time, no changes have been affected to our appropriations, and we don't anticipate that for this year. So at this point in time, our institutions, central office, those are in pretty good shape. Overall, we're in the black. We would expect it to stay in the black. And kind of this is where I'll reference those handouts that we had. Our department totals, when you look at the very bottom right, it's showing 0.71. That's 71% of our budget has been expended to date. This is through March, and we would expect through March to be closer to 75%. So we're in pretty good shape overall on our department-wide. Similarly, on the second page, the institutions is showing at 72%. The range of the different institutions is 69% to 73%. So overall, we're in pretty good shape there too. We, of course, as always, we're going to have issues at isolated places. Pharmacy is one of those challenges this year that we've had some increased costs due to some things occurring with individual incarcerated individuals. But we're dealing with that. We think we're in pretty good shape to finish out this year. Central office on the third page, and Joanne is bringing that up. We're actually at 61% of total expenditures. Why that varies compared to the institutions and the overall, we have some pockets of money that don't necessarily get spent as normal. So when you're 75% of the way through the year, maybe we haven't gotten billed for a month or two of those services. One of those areas is the county confinement that I referenced a little bit ago. That's in arrears. We get billed the following month for the previous month's services. So it's not as we go, it's a kind of in arrears, which then causes us to be a month in arrears for that percentage, basically. So that fourth page is actually our county confinement. So if Joanna, if you can go to that fourth page, this kind of shows you at the bottom of that page, we're at 62% of the expenditures. All that tells you is that we've got a month still to come in. We actually were behind at one point in time on this budget line, but the district did a phenomenal job of making sure we were getting those folks that are in our county jails through the revocation process in a timely manner, and only holding those that we absolutely needed to. We actually, as of March, we're in a pretty good position. But once again, we have those additional expenses that are occurring now because of holding those folks that otherwise would be being brought to prison. So once again, that will be something we will be putting through the federal sources to be refunded. The fifth page is our federal prisoners. This is another one that we don't necessarily aim to spend entirely. This is one of those areas where we have a little bit of flexibility. What this funds is it funds our religious services for Native Americans and the Muslim community, and also funds our relationship with the Bureau of Prisons as far as incarcerating those individuals in federal prisons that we need to move out of our system. There's a relationship where we kind of trade off. There's not a lot of expense there, but it's one of those unknowns that at any given point in time there may be additional expense. So this is one, at 44%, we're actually in pretty good shape. It may be an area where if we need to tap and move some funding to other places in our departments, this may be an area where we may have additional resources. The last page on this handout is the education. And this is another one that is one of those that's in arrears and causes that central office one to kind of be out of whack at 61%. It's showing at 48% of the expenditures. We don't necessarily get those bills. So what this is mostly funding is our education in the institutions that is being done through the community colleges. So we've got partnerships with regional community colleges that are billing for those services that they're giving for high-set literacy types of programs, vocational programs that are being administered in all 9 of our prisons. Once again, this is one that we don't necessarily get the bills as timely as we would hope. But there also is a little bit of, once again, maybe they're not spending all the money as well. So we're keeping an eye on that. We do believe that at this point in time, it does identify that we will have a little bit larger carry forward into next year than we brought into this year. So that 48% is, once again, that's not necessarily through March. That would be through sometime probably in February. Some of them have submitted for February. Some of them have submitted for now March that we're getting now. So those are kind of the reasons why that 61% for the central office page, why that's lower than what we would expect to be closer to the 75% for the year. So overall, I think we're in pretty good shape. The one thing I do want to bring to light that is the community-based corrections. At this point in time, they have experienced some significant revenue changes due to their residential facilities trying to clear out some of those beds for quarantine purposes, and also trying to get those people out so that if we had an outbreak, that it's not going to affect as many people. It allows us to isolate some folks if we need to. By doing so, those folks are paying rent on a daily basis, and the ones that are left, because of the effect on the economy right now, we have quite a few that are unemployed. A lot of those folks are employed in the service industry. Some of the meatpacking plants that have closed down has impacted us as well. So the CBCs are definitely seeing a decrease in revenue on their local revenue, and they're dependent on that. The other piece of that is on the community part that's not in the residential facilities, we have less client contact. We are not having that direct contact with those individuals on a daily, weekly, monthly basis like we have in the past. They're using other means to do that. That affects their supervision fees. By not having that, also that client contact, groups have been affected. Treatment groups for domestic abuse, for sex offender, are being done in different ways, and maybe not to the entire populations at this point in time. So that has affected their revenues as well. What I want to kind of bring that to is, as we move into the conversation for next year, that is definitely affecting not necessarily their ability to get through this year. As we've seen from the forecast and have talked with the districts, they're in pretty good shape to end in the black this year, but it has greatly affected the amount they're going to be able to take forward to protect them into next year. Also, those declining revenues, we don't anticipate are going to necessarily turn around immediately. We're going to see a gradual increase in some of those filling back up of the residential facilities, and also that client contact, getting those supervision fees and getting those groups back up and going. It's not going to be something that's going to happen overnight. So that's not going to necessarily just affect them through June 30th, but probably at some point as we get back to as much as normal. And of course, if there's another outbreak, all bets are off at that point in time. But so we're projecting that going forward as far as an effect still in place to those revenues. So overall, FY20 that we're in right now, I think we're okay at this point in time. We may have to shift a little bit of monies around as needed, and we have done that in the past to make sure that we've got everybody taken care of. Those major areas that we've had issues with in the past, the county confinement, as long as those fundings come back from the federal sources, we should be in good shape. Same thing with the EMS that's done through the 5th Judicial District. As long as those federal monies come forward, we should be in good shape on that front as well. But as we move into FY21, and we've had conversations with the governor's office, with the Department of Management, and such, we all know that the revenues have dwindled, and we just don't know what that effect is going to be on next year's appropriations at this point in time. We believe that the legislature probably is coming back into session at some point, probably either later in the month of May or in June. But that may affect the timing of when we actually get those appropriation numbers for FY21. We do know that also, once again, as I talked about with the CBCs, those lowering of those carry forwards, and also the lessening, lowering of those revenue estimates for their local funds is definitely going to have a great impact on their budgets moving forward into FY21. Once again, there's a lot of uncertainty, but we're trying to prepare as best we can for all scenarios. So we will probably start doing some exercises on what would happen if in different scenarios, without revenue replacement, which we don't think is going to occur at this point in time. We're still pushing for, but that definitely greatly affects the CBCs at a disproportionate amount towards the institutions in central office, based on being appropriated funds versus local revenue. So once again, we continue to work on those exercises, what that would mean. We are unsure of appropriation amounts at this point in time, so we probably will start some exercises on if there was a cut, starting to at least think about those things, not putting anything in place, but starting to think about and plan for all scenarios. So that's kind of where I'm at this point in time with FY20, FY21. A lot more to come. Those federal applications, we've been told, should be rolling out soon. We'll have things ready to be able to submit for those in a timely manner and get those expenses that we've had up to this point that are COVID related funded. So I guess I would open it up to any questions or comments.
Hey, this is Rick Lemire. I have one. Can you hear me?
Yeah.
Yes.
Okay. This has been bugging me for a number of years. I go back 2 directors on this. The fact that we're being forced to support 2 religions over all the other religions that are out there. I was wondering if you could explain that, what the dollar amount we're giving to each of the 2 religions that you pointed out.
We have contracts through the state at this point in time, and it's not to exceed, I believe, $5,500 a month for chaplain services for those 2 religions throughout the state. I don't know.
No, what's the yearly rate? Well, let's take the American Indians. What's the yearly rate that the Department of Corrections is paying that particular religion?
Sure. Give me a second here. So on an annual basis, $66,000 a year for those services to be deployed statewide at all institutions.
No. What's the breakdown? We've got 2 religions that you mentioned.
Yeah, $66,000 per.
For both of them. So we're paying $66,000 to the American Indian, and then $66,000 to the Muslim religion. Correct?
To facilitate those services.
Could you explain the history of why we're doing that, as opposed to why aren't we paying, Lutherans or Catholics or Presbyterians or any of the other religious services? Because I believe those are provided free, aren't they?
We have chaplain services in I believe all of our institutions that deliver those services.
And we're not paying those religions, correct?
We have chaplains on staff at some of our institutions.
Okay, yeah.
Hey, Rick.
Are we? Yes, sir.
This is Michael Sabal. I'm sorry to interrupt. The history on those 2 religions is those are the result of some past litigation where the court required us to hire a consultant for the Native Americans and for the Muslims. And so that's the reason for those specialty contracts. And I'd be happy to go back and get those court cases for you.
Oh, I've got the court cases. This was brought up to me by a private citizen a number of years ago. In fact, I said 2 directors ago. So I'm pretty familiar with it. And my conversation with the last director is this thing was, particularly with the Muslim religion, was up for kind of a review. This was a thing that was an agreement with the Attorney General's office of the state of Iowa to settled a lawsuit that was filed. But, and again, I'm just throwing out my personal thing. This whole thing has been buried. If this one person had brought it up, we wouldn't be talking about it. And I'm kind of I'm impressed with Cord bringing up. This is the first time we've really brought it up, that it's been brought to people's attention. I don't know if the other board members or the general public actually knows that we're paying, you know, a couple of religions and not paying other religions. That's just one way of looking at it. There could be other arguments, and but I think it's open for discussion. You know, you're paying $66,000. You know, that's a correctional officer. And when money's tight, then my question is, why are we continuing to do this and not paying the other religions? I thought where there's separation of state and church. I'm just throwing this out for discussion. It's never been brought up before in public like this, and I appreciate Cord bringing it up and giving the opportunity to talk about it.
Do we know why some religions require payment and others don't?
Right.
Is there a particular reason?
Yeah, and this is Michael. Yeah, the reason is because we've had some past litigation where the state agreed to hire those specialized consultants for the Native Americans and the Muslim religions, and so that's why you see those two line items in there. So the rest of the religions, you know, we do provide a lot of volunteers that come to the institutions, a lot of outside religious organizations that do come on site. And, you know, in the past we've tried to streamline our religious services to offenders, because just because they're incarcerated doesn't mean they lose their full freedom of religion rights. And so we have developed a centralized process to try to accommodate the religious requests. We have a statewide religious coordinator that reviews all of those requests to make sure that they're consistent and that there aren't any security concerns or operational concerns with the type of things that they're requesting, such as ceremonial items. And then we do have a statewide religious review committee for any appeals that our inmates can file with the statewide committee on the type of religious practices that they want to undertake. So, I think just in the broadest scheme, Bob, just talking really broad concepts, just to kind of give you an idea that, you know, religion is important, and it's something that we try to facilitate statewide.
Yeah, was there no, even back then or now, is there no, for the two religions we're talking about, volunteer services available that we can utilize instead of paying them like the other ones? Have we looked into if volunteering is an option to save that money?
You know, and I think back when those settlement agreements were entered between the Attorney General's office and you know, I think it was just because they were two very highly specialized religions, and that the court ordered us to provide that. So,
Hey,
yeah,
Michael,
yeah.
was there a statute time frame on that litigation agreement that was done? I'm not familiar with the case, so I don't know if there was a number of years we had to provide that, or can you elaborate on that?
No, I don't believe there is. I think it was just a general settlement that the state would, you know, hire two specialized consultants in those areas, and that's what we've done for a good number of years. But I'd be certainly willing to, you know, swing back around with the Attorney General's office and have that discussion.
I think you should, because I think there was something in there that was up to review in like maybe 2014 or something. Listen, this is what I've done. When I took that complaint from the citizen, and he had also written a letter to the director at the time, and I can't recall who that was, but the citizen basically got blown off, and that's why he called me. And he had uncovered this. He had been doing some contract work with the government. And and if he hadn't been doing that, I mean, you normally wouldn't see that in the budget. It was buried so deep you couldn't see it. So naturally, I get kind of suspicious and say, no, you know, why isn't this more out in the open? You know, we go over this whole budget, and we've really never talked about how much we're spending. I'm educated now. I thought that the Muslim religion was paid about $66,000. The American Indian religion was just provided with some ceremonial situations that they needed. And now I understand that both are being paid $66,000 a year. Is that correct now?
That is correct.
Okay, all right. Well, that's news to me. I just thought that the one was. So now we're paying the two. And I understand that the one that was, there was a nationwide lawsuit. But again, that was supposed to be, after a period of time, reviewed. And, as a taxpayer and as a board member, that we're responsible to making sure that the taxpayers' dollars are spent in a proper manner or spent wisely. If most of the religions are volunteering, I think all of them should volunteer. But again, that's my personal opinion. And, I could be shown that I'm wrong. But I appreciate that this is actually being brought out in the open, because I've discussed this with two legislators in particular that I know, and boy, they look into it, and then it's like they didn't want to have anything to do with it. They backed off, and I was kind of disappointed in both of them. But anyway, I think this is something that needs to be brought out in a discussion and talked about. Have somebody that made the decision that is making the Department of Corrections pay this money. You either pay all of them or pay none of them. That's my opinion, and I'll just let it go at that. But I think there's some good documentation, and I do have some of it that was provided to me by the individual that had brought this to our attention. Of course, he just passed away a couple of months ago. But anyway, I do know there is a paper trail, and there's legal documentation that shows how we got into this particular situation. But I think it should be forefront that we say, hey, if we're spending X number of dollars for a particular medication, we should also be saying, hey, this is what we're spending every year, to these two religions over the other one. So.
Sorry to interrupt. Did I understand correctly, though, that we do pay, the board or the department does pay chaplains? So we're not talking about free services versus the $66,000. I mean, is that correct?
No, it's my understanding that these other chaplains from the other religions are providing their services voluntarily. And I could be wrong, correct me if I am, but the two religions are actually, their ministers are being paid that amount to provide their particular religious services to our prisons.
Okay, I guess I had understood from Steve in the budget that there were chaplains on staff. But
yeah. Now, and if you remember, I believe this is the first time this has ever been brought up in a meeting. I've personally brought it up to the two previous directors, and talked about it and said, hey, it'll be looked into, and then nothing happens. So.
And I have asked each institution on their chaplains. I believe we do have paid chaplains at most of, if not all of our institutions. So I'm looking into that currently.
Good. Can you figure out how much we're paying them so we at least know that?
Yeah, and that would be a chaplain probably at each one of our facilities, not one statewide. So.
Now, is that a chaplain assigned to a particular religion, or they just provide generic religious services?
I'm assuming it's generic religious services.
Okay.
Perhaps this is Lisa. Perhaps at another meeting we could dig into the legalities behind the Indian and Muslim religions.
Yep, we can do that. We can actually.
Because I'm going to guess there's a lot more to this that we need to understand.
Yeah, and we can.
And that might help us understand why we have.
Yeah, and we can also get that money, the cost as well for the chaplains, so you have that information as well. But I think we could expand on this discussion.
I appreciate that. I think that's a wonderful idea.
Okay, we have it noted.
Yep. Thank you very much. Okay, Beth, what's the next topic on our agenda?
Public comments.
Okay, at this time, if there's anyone from the public listening that would like to make a comment, please identify yourself, and then we'll give you as much time as you need. Okay, I hear no one. Shall we go to the next one? I believe should be from the board members, correct?
Correct.
I'd like to start off really quick by telling you how proud I was of the whole Department of Corrections. You know, every time I started reading about the responses, making the masks and the hand sanitizers, how you guys just jumped right in. I mean, immediately, before a lot of other either departments or businesses or communities, groups, you guys were at the forefront. And not only am I proud of the employees, but I'm proud of the prisoners, those that are incarcerated that jumped in to help. And that's about all I have to say. I was just had a good feeling, and I was very, very proud of what you guys are doing.
Thank you, Rick. I really appreciate that. It definitely is a team effort, and it was all hands on deck. So thank you for acknowledging that. We have a great team, great staff, and those individuals incarcerated really contributed a lot during this time.
Yeah, is there any way to identify, not by name, but say if you had a team of prisoners that were working on making masks or something,
Mm-hmm.
you know, some way to compliment them, either publicly or maybe a letter from the board to their file or whatever.
Sure. Yeah.
That might be a lot of work, but that's what crossed my mind. I said, geez, I'd like to thank that prisoner that's working really hard to make a gown or make a mask
Mm-hmm.
or whatever.
Yeah, I think we certainly can get a list of names and do a letter or however whatever you think is best in terms of recognizing them. But we can do some. We can find
Sure,
out who those individuals are.
Yeah, and I don't think there's a rush on it, but I think in the long term that would really, you know, help that individual to, you know, make him feel important, make him maybe one time in his life or her life that they actually did something very, very good, and it's good to recognize it.
Yep, we'll do something.
All right, that's all I have to say. I'm sure Larry has something.
Well, I just want, you know, just a follow up to what Rick just said, you know, we hear a lot about heroes out there working on the front lines and stuff like that, and I consider those folks that are doing those kinds of things just as much as heroes as some of the other people that are out there. But the only thing I want to say is I'm glad, you know, I was impressed when Beth set that out in, I guess it goes back to March now, but the policy that we had to deal with this and how early we came up with that. And I think that policy has saved us a lot of heartache. And I just want to commend you folks for coming up with that policy as early as you did, and you weren't sitting there waiting for somebody else to figure it out, that we took the bull by the horns, got people out of the prisons, and set up procedures. So thank you so much for doing that. I commend you on that, and the people that worked on that and got that done.
Thank you, Larry. Appreciate that.
Board, any update from the Hill?
Nothing really major to update, just keeping our friends in the legislature informed of everything we're doing. Many of them are actually watching this right now through our live stream on the YouTube channel. And as soon as they get back together, we'll hear what they plan to do with the budget situation.
All right.
Rick, I have a couple of things. First, this is Mary. I'd like to acknowledge our director. I was watching, well, on a daily basis, I watched the update from the governor on what's happening with the pandemic, and I was response to it. And Beth was a part of one of the press conferences that the governor held, and I thought that Beth did a nice job of you know, explaining how corrections was engaged and addressing and being helpful in advancing how the state is attacking this disease. So thank you, Beth, for representing the corrections community. And secondly, I, along with several corrections staff, are on a statewide corrections advisory committee, and I attended a Zoom meeting yesterday, and I think, you know, I'll be updating, you know, the board in the future as we plan out what happens with this advisory committee. I think there were 2 grants that were received, one from the Lumina Foundation and one from, it was another, I think we'll say Halcyon Foundation. Ascendium Committee to study the education opportunities for offenders. And so, you know, addressing, utilizing the education, the public and private sector, as well as correction staff, and looking at how the partnerships can be strengthened in addressing education and support needs of men and women that are in the institution and their return to the community. So, it should be an interesting journey to see what happens at the end of 5 years of this planning process. So that's what I have to say.
Thank you, Dr. Chapman.
The only other thing I had was, as the board, do we need to respond to that letter from Ms. Kennemer regarding Mr. Williams? Or did the department respond to her and address that situation?
What? I'm sorry.
If I might, can I butt in really quick? Normally what happens when we get a letter like that, you know, I'll review it and then I'll talk to Cord, or was Abby, that, you know, reviewed it, and I think it's better to have the department respond, and I believe the same thing in this thing. I did not respond via email to that, but after review, I think it's good to have the department respond as opposed to the board. And I believe we've covered this before. When we do get these letters, the following meeting, I think it's brought up that, you know, we had 2 letters that, you know, were reviewed, and I think I was appointed, and correct me if I'm wrong, to be the point to actually review those letters that are just addressed generally to the, generically to the board. In this case, it was addressed to each and every member. Again, I think the department can handle this if you are in agreement.
I'm in agreement. I just wanted to make sure it got handled.
Yeah.
Yeah, I think we came up with that policy either earlier this year or maybe late last year. We came up with that policy. And correct me if I'm wrong, Michael, that we've got a policy now basically that provides for what you just said, Rick, so we don't have to respond to these individual letters that we receive if that procedure is followed, I guess. So.
Yeah, I recall you guys putting that policy together. We can send a copy of that back out to everyone.
Okay. Because maybe Mark and Webster haven't seen that, because that might have been done before they came on the board.
Yeah, I think it was.
I think you're right.
And just so to give everybody an update, usually we get 1 or 2 letters between each meeting. So they're usually handled. I review them very thoroughly, and then I make a decision. Well, this should be a board thing, or it should be the department should respond. And so far, all the ones I reviewed, that's been the agreement, to let the board respond, because I think that in those particular letters, after the review, it should be handled by the department. And we haven't had any complaints or since, so I think it's been going all right.
Sounds good to me.
Anyone else have any comments or questions or anything?
So I just wish you could join me here on the beach. It's really kind of nice to have this. You can't see me. I've got a water in the palm tree in my back room. I'm out on right now. So.
You know, Larry, I commented earlier that when you turn your head, it looks like you're looking into the ocean or for seashells.
It is.
Yeah, it's pretty pick the background for Zoom meetings.
I like it. I like it.
Thanks for wearing your shirt.
Yeah, you see shirt. I'm not going to say what's below it. I'm fully dressed. I'm okay.
Well, on that note, I think it's a good time to call this meeting to an end of this meeting. Can I have a motion to end our meeting this month?
So moved.
Do I have a second?
Second?
All those in favor of ending the meeting, say aye.
Aye.
All those opposed? The meeting is officially over, and I hope that everyone is doing well and that maybe we can get together next month. I'll leave that up to Beth for her advice on what the situation is, and we can discuss it here in a couple weeks.
Thanks, everyone. Take
Thanks,
care,
everyone. Take care.
Thank you.
Stay well.
Thank you.
Bye.